Yo, what's going on, guys? Today we're gonna go over some tight hips. So, client is experiencing some tension whenever they are going in depth into their squat, and so it'll feel and cause a lot of tension right in here in the inguinal area, and especially whenever they're just trying to open up. So, by working this area, what we're trying to do is we're trying to scan in and find any densification in the area. And work as lightly, but also give a little bit of pressure so we can feel. And as we can feel right in here, there is just a line of tension that's pulling on this vastus medialis, causing a lot of tension right up in this area. So we're just going to polish through and see what the body tells us. Now what I'm feeling is, I'm feeling more of a isolated adhesion or knot in the leg, right in here. And it's, at first I was thinking it was going to be more in the adductor area over here. But in fact, now it's feeling a lot more like it's around this area, which is going to be the vastus medialis and the rectus femoris, because it doesn't feel very deep, it feels very light. Okay. So now, as I palpate and feel, you can begin to see some of the striations in the quad. You can see how it kind of pulls all throughout the area, and you can see that reaction when I just put a little bit of pressure on the knee area, how it affects the vastus lateralis, and we can see how the whole quadricep area is really what's causing the main tension for all of this opening and adductor tension when squatting. One thing that I do like to incorporate with my sessions is somatic awareness. So what I like to incorporate with my sessions is I like to incorporate somatic awareness, which is basically having a proprioception of yourself and having an understanding of what it feels like to be tight and what it's like to be relaxed. As you relax the tissue, you'll be able to do more things. You'll be able to activate more muscles throughout the movements, especially if you work out, or even if you're just daily living and daily driving with your body. You will begin to notice what it feels like to have less tension. And by having this somatic awareness, you can understand when it feels like you need more work. You can foam roll, you can use heat pads, you can find ways to work on yourself creatively. You can get into a sauna, go for a walk, have a little lymphatic flush by walking. All of these things will help you alleviate tension whenever you begin to start to feel it creep up. But you won't know if you get used to it. And so having that somatic awareness, the self-awareness, to feel it and understand, oh, okay, this doesn't feel normal, it's not meant to feeling like this, then you can be more self-conscious and self-aware on how to deal with a lot of this tension. But as you can see, as we move up closer up to the top, you get to see a lot of that tension pull across. And you can see how it pulls all over throughout this leg. Actually a lot more tension than I thought there were going to be. So let's do some thixotrophic effect and heat up a scraper. How are you doing? You doing okay?
Yeah, I feel great.
Are you dying?
No, I'm not actually. I feel like I needed that. Like I do foam roll, I would say like once every 2 weeks.
Hey, that's better than most. Yeah.
I like the little ball you gave me, so I feel like I use that a little bit more than I do foam. that sometimes it's kind of hard to get right up in the area, you know, you need to
Mm-hmm.
work on.
Do. Okay, what else can we use? Well, we might use this. And
Spare gadgets.
yep, I'm warming up. Okay. All right. Starting back up. Here. So right here, you can see some of that restriction pulling, especially on this IT band. You can see a little bit of that pull. Also, by going through these areas, adding a little bit of tension work can help stimulate some irisin response, which will help tighten up skin. It helps with the proteins, and it'll help it to go into the collagen and just relax and tighten those areas up. That's why these fascia blasters are so awesome. And actually, Black was probably one of the first ones to figure that out. That the irisin response in doing this is really helping a lot of that adipofascial to go away in the event that there is some, which there is a little bit, but not a lot. And there's a lot of muscle here, so for
So
people,
what creates that?
it's going to be fascia, repetitive range of motion, genetic dispositions. So sometimes that's what some people, it doesn't matter if you work out, if you have a lot of muscle, you're going to get prone to getting that. And everybody will. Like, I think that that's why those who work out typically, their skin stays a lot more elastic. It's due to the trauma and the irisin response. And that'll help relax a lot of this tissue up. Now, irisin takes time. It's not something that, you know, you go crazy with at every session, but just a little bit of light work with the fascia blaster daily can help out. But let's go in and let's do some heated scraping. Let's see what we find. Seeing less pull over here on the lateral now. It's not perfect, but it's getting there. And as that heat and thixotrophic effect starts to take place, we'll be able to dig deeper and deeper into the tissue. You can feel in this vastus lateralis now, starting to feel that pull pretty bad. And it kind of makes sense that like all of this is tight over here and then it's pulling over, causing the tension to be present right there. Right here I'm seeing how vastus lateralis is pulling and also causing displacement to the knee almost. And so just like the client just weighed me down. Yeah, that's what.
Yeah, I've noticed that I've never noticed this, but as I'm squatting, I feel like my knees are starting to cave.
Mm-hmm. And it's because all of your quads here are tight. The vastus medialis is actually causing a lot of tension and trying to compensate for all of this tension over here. And then it's coming all the way down into this knee right here and creating a mound of tension.
I feel like a knot there actually that I've never even noticed.
Yeah, it's just right in there. But it's melting away. There you go, that's starting to feel way more relaxed. Right there. So now we're going to use the silicone active release with dynamic cupping. So we're just going to put the cup on like this and actively move it. It's going to pull a lot of that tension. Now this is the lighter way to do it. You can use a plastic cup and it'll give much more deeper of a pull. But judging by the sensitivity, I'm going with a lighter cup. You can definitely feel that, huh?
Mm-hmm.
Look at that. And after we get over it, you can see how much tension there really is there. And as I'm moving the cup, I can feel the fascia pulling on that knee as I move upwards, and I can see some visible cues over here. Boom. Right here. Right there, you can see all that. Just there we go. Much more easier. Here we don't see too much, but you can see definitely over this knee right here how much tension there really is. I'm not going to use that. I'm going to use a heated scraper. And very lightly just work through. So what I'm checking right now is I'm using the cup to pull the skin over so that way I can see where the true tension is lying and just detail it. Sometimes you just go with the flow, and in this situation, this is what we found. Have I done this before? Never, but you kind of just, every day should be a learning process whenever you're doing massage. The bodies are always going to be different, and so you have to figure out new styles to relieve tension. And just like that, we're seeing the knee relax a lot more, and it feels like the cup is even relaxing a little bit more. So now let's give it a good little upward motion. Yeah, right here. So right there. You can see that pull right here. So that's exactly where we go. Can you feel that thud?
Mm-hmm.
All right, let's give it a go. We're here, light one, and then we're gonna push upwards. Oh yeah, it's gliding a lot more. Right there. So that's where you feel it right here?
Yes.
Okay. Almost like a little bump there.
Kind of to work it out, right? So if it's like this, you rubbing it down is basically gonna
Flatten it. Yep.
Smooth it.
Yep, and that's what we try to do. Now, that's one way to tackle it on. The other way is we can use cups, right? Because like right now I'm putting a lot of pressure and I'm trying to smooth it out, right? But sometimes what you need cups to actually pull it apart. So versus pushing it downwards, it's pulling it upwards. That's why this works effectively. And the cups work effectively. The static cupping, when we leave the cups just alone for 5 minutes, is a lot more relaxing and it's not as intense as that.
Yeah, because this is like moving it. Like you can feel where it's lifting.
Mm-hmm. But can you feel that difference already? Right? I can feel it now over here. How it's all tense in the hamstring. That's okay though, we'll get there.
And it's basically the same concept. What happens up here could possibly happen in the back too.
Yeah, And actually right there is where it'll pull on the knee, inside of the knee. It feels like it pulls inside. Yeah. It's right there.
Yes.
Yeah, but that's a whole, we'll get to that one later. Let's just cup this part and then even out both of the legs, the quads. All right, where are we at? Okay, here we go. So now what we're gonna do is we're gonna trace the tension. So we found tension over here. Some of these cups don't work very well, so I have to put a little bit more air in them. So it's gonna be more than 3. But most of the time I just do 3. I feel like 2 is a good amount for her, just judging on how the tissue reacted from it. So 1, 2, I think that's perfect. Just like that. And we're just gonna put the cups all around the leg and trace it. Just like this. This one's a little bit loose, so there we go. One cool thing is that now you can see those bumps, so you can see boop, boop, boop. And what these are is it demonstrates the tension that is being banded across the leg. So when we use cupping, we're pulling, and it's going to tighten up this tissue, so you're actually going to be able to see the tension cross over, and you can see kind of how the body adheres and creates these basically like scar tissue or casts to help compensate with the body. So whenever the body gets weak in one area, another area will compensate for it, and it kind of creates this cast around to help protect itself. The adhesions and the knots that we feel aren't the problem sometimes. It's going to be all of the factor that it's the body's natural way to try to protect itself. So just because you have some of this isn't bad necessarily, but it can, if it doesn't remove its way naturally, because normally a lot of this densification is supposed to be removed through exercise and being active, but if we're not, and even if we are, sometimes it's not enough. And when it's not enough, it will become very, very dense, overcast itself, and then it causes a frozen motion. So you're not able to move your leg, your arms, your shoulder the way that it should, because you have too much of this casting and protection of your own body. So when you're doing decompression, we're doing massage therapy, this is why it's so effective and such a great treatment for just anybody, whether you're an athlete or an everyday person, that you're just dealing with stress. The body reacts the same way with stress. It starts to cast up areas and starts to store tension. If you're constantly overthinking, your traps are going to get tight. It's going to try to protect your head. There's a lot of different ideas, and we're still growing in the science, so these are not all factual, but the conceptual idea remains the same. So this is just one prime example, but we're going to leave these cups on for 5 minutes, and then we'll check back in a moment. Okay guys, so now we've left these on for 5 minutes. I'm going to go ahead and remove these cups right here. And we're going to check to see if we see any discolorization. And for right now, we're not. We do see one that seems a little bit darker than the others, but it's not very much. Right here, these three. So notice one thing, guys, is that when we were massaging and we were going through, we really worked a lot more on this area, this area, this area, and around the knee. Now, where's the darker area ones? Well, there's one right here, and we didn't really work that one too much. This one right here that we worked out a lot is a lot lighter, and we have darker ones up top. Why is that? Well, it's because we didn't work these areas as much, and we didn't work this area as much. This lets me know that on the next session, I need to be a little bit more thorough working. We need to work more on the hip area, and we need to work on the lateral portion. But my whole idea was that we couldn't get these hips to open up when we were squatting. So what I wanted to do was I wanted to make sure that we get that. Now if she opens up, yeah, she feels that. I'm bending it in. You can see that there is a slight pull right here, but she can feel like she can open up a lot more. I feel the looseness in this leg is just feeling a lot more looser. So this is a prime example of how these darker cup areas are significant in the fact that they will show you where there's more vasoconstriction, and that can be from the fascia. Once again, guys, this is just a small breakdown. I was going to do both legs, but this video is already long enough. So guys, if you haven't already, please hit the like, subscribe, comment. Let me know what you think about these videos, if you like the live versions that I've been doing, and we will catch you on the next one.